It makes things easier to cope. As far as I'm concerned, I'm home. I've been in hospital several times in the last few weeks, unfortunately, but luckily now I'm coming to the end of treatment, but also I'm able to be treated at home, which is a big relief when it's gone over so many weeks. So it takes the pressure off for home for me. To come home after you've been in hospital for a while, first of all it feels very strange because you've been relying on somebody to do everything for you, telling you whether you can go to the toilet or to whether you can have a cup of tea and how long you've got to wait for that anyway. And so, first of all, when you come home, you think, oh, who's going to do that for me now? And then you realise that's what your husband's for. But of course, it's got to work. It's got to work both ways, and it's lovely to come in your own front door and be able to think, I can relax because it's us.
So patients are absolutely loving being able to go home, quite understandably. So they're loving being able to have their treatments at home, particularly with the IV patients where maybe they're on really long courses up to 6 weeks. That's a long time to spend in hospital if actually, generally any otherwise, you're feeling okay. Patients are feeling that actually daily phone calls are reassuring enough. They're actually happy for that input. They feel like that's actually enough for them. What I've learned so far is that I'm managing quite easily with the electronic side of it. I'm supported well. The staff come and help me if I need it at home, and also if there's anybody needing to give me any advice, I can phone up and I can get it straight away. There's always somebody who seems to be there for you. It's good that the nurses came in as they did the other day, and it's going to happen again this week because I believe I've got to have blood taken again this week. Well, I've got a son and a daughter, and they both do as much as they can do. They both work full time. They come when they can, and they know that they're not having to wait until visiting hours. And they're not going to have to try and get up to Derriford and try and find a parking space. So if they've got 10 minutes that they can pop in and see Mum, and hopefully Dad as well, then that is going to be 10 minutes with us as opposed to 10 minutes up the road and then another 10 minutes to find this and that. So hopefully that means that they feel less pressure and are able to come and we become a family again.